Welcome back for another deep dive. I'm really intrigued by this one. We're going to take a close look at Pion therapy, and I know it's cutting-edge stuff in cancer treatment.
Yeah.
We've got some really interesting material to go through, including a fascinating piece by Jörg-Owe. Have you had a chance to look it over?
Oh, absolutely. Pion therapy is remarkable. Using subatomic particles, pions, to target and destroy tumors, that's some next-level precision in radiation treatment.
Right. And what I find really cool is how it differs from the conventional radiation therapy we're all familiar with. Our sources, they highlight this Bragg peak effect, and it sounds like it could be a game changer, especially for sensitive areas like the brain and spinal cord, where minimizing damage to healthy tissue is absolutely paramount.
It's all about focusing the energy, delivering it precisely where it's needed, and if these sources are right, the Bragg peak effect could be the key to achieving that. Imagine, like a laser-guided missile for cancer cells.
That's a great analogy, less collateral damage. So, for this deep dive, let's really try to understand this Pion therapy inside and out. How does it work? What are its advantages, limitations, what's on the horizon? And we'll stick closely to the information you've provided us.
Sounds like a plan. Let's unravel the mysteries of Pion therapy together, starting with the basics. How are these pions generated, and how do they attack the tumor?
Yeah, let's break it down. Where do these tiny particles even come from?
Well, think big, massive machines called particle accelerators. They're like these scientific marvels where protons are smashed into a target material at incredibly high energies. These collisions produce a bunch of particles, and among them you have our stars of the show, charged pions. Now, here's the fascinating bit. These positively charged pions, they travel a certain distance in the tissue and actually come to rest before they decay, and that's the secret to their precision.
So it's like a timed detonation. They release their energy right at the tumor site.
Exactly. That's when the magic happens. When these pions reach the end of their journey and come to a halt, they unleash their energy right where the tumor is. This minimizes the damage to surrounding healthy cells, which is crucial, especially in sensitive areas like the brain or spinal cord. And even the decay process itself plays a part in the therapeutic effect. Charged pions, they decay into muons and neutrinos, while neutral pions decay into gamma rays. It's this cascade of energy that really packs a punch against the cancer cells.
So it's not just the initial energy release, but also these byproducts that contribute to the tumor's destruction.
Precisely. You have this highly localized energy deposition at the end of the pion's path, plus the additional radiation from the decay products, all focused on the tumor. Your sources suggest that this focused energy delivery could potentially lead to better outcomes, particularly for tumors that are resistant to conventional radiation.
Now, the materials also mention clinical applications and even touch upon proton therapy, which seems to share some similarities. What kind of solid tumors are these therapies typically considered for?
Proton therapy, utilizing a related principle, is being considered for a wide range of solid tumors, according to your sources, especially for tumors near critical structures. Think brain and spinal cord tumors, head and neck cancers, tumors of the nose and eyes, places where conventional radiation could pose significant risks of collateral damage.
Absolutely. Precision is key in those areas.
And the list goes on. Rectal and anal cancers, pancreatic tumors, liver tumors, sarcomas in the bones and soft tissues of the spine and pelvis, lung cancers, breast cancers, esophageal cancers. But it's crucial to highlight, and your sources do emphasize this, that these therapies are generally not effective for metastatic cancers. They're primarily aimed at treating the original tumor locally, not when it's spread throughout the body.
An important distinction. It's also interesting that the materials mention advancements in cancer treatment more broadly, such as combining proton therapy with immune checkpoint inhibitors or using AI for treatment planning.
Definitely. Your sources mention studies exploring the use of proton therapy in combination with nivolumab, for instance, for certain rare central nervous system cancers, showing how different treatment approaches are being combined for better outcomes in specific patient groups. And the use of AI for optimizing radiation plans. That's another exciting area that could help fine-tune precision even further.
That's huge. If AI can help tailor the radiation to be as effective as possible while minimizing harm to healthy tissue. Now let's dive deeper into the benefits of Pion therapy. The high precision due to the Bragg peak effect, it's clearly a major highlight repeatedly emphasized in your sources.
The Bragg peak effect is really at the heart of it all. Like we said, pions deposit the majority of their energy right at the end of their path, directly within the tumor. Imagine it as a targeted strike, delivering a concentrated dose of energy while leaving surrounding healthy tissues largely unharmed. Especially in those sensitive areas we discussed earlier, this advantage is invaluable. It potentially allows doctors to deliver higher doses of radiation to the tumor, which can be crucial for overcoming resistant cancer cells.
And this sparing of healthy tissue, it ideally translates to fewer side effects for patients, right?
That's the hoped-for outcome. Because less radiation reaches healthy tissues, your sources suggest that patients treated with Pion therapy often report fewer complications and a better quality of life compared to conventional radiation. They mention less fatigue, reduced skin irritation, and less hair loss as examples.
That sounds like a significant improvement in quality of life, both during and after treatment. And there are even indications that Pion therapy could potentially lead to higher success rates.
Yes, the concentrated energy released during pion decay could be more effective at disrupting the DNA of cancer cells, preventing them from multiplying. Your sources suggest that this might lead to better tumor control, especially for solid tumors that might be more resistant to traditional radiation. It's like delivering a more precise and powerful blow to those cancer cells.
Another key aspect addressed in your materials is the accessibility of this therapy. How widely available is Pion therapy today, and what's being done to make it accessible to a wider range of patients?
At the moment, Pion therapy isn't widely available. The main hurdles are the high cost and the complex technology required for Pion production. But your sources emphasize ongoing research aimed at improving the production and handling of Pions and developing smaller, more affordable particle accelerators. The goal is to make this promising therapy more accessible to patients in the future. There are some promising research avenues in the field of superconductivity, for instance, that could lead to more compact and efficient accelerators.
That's crucial, of course. Even the most effective therapy is of little use if it's only available to a limited number of people. Now let's talk about the potential downsides. What side effects and risks are associated with Pion therapy, even though your sources suggest that they tend to be milder than with conventional radiotherapy?
It's important to be aware that Pion therapy, like any medical procedure, is not without side effects and risks. Even if they're generally considered less severe, your sources offer some insights into this.
What are the more common side effects that patients might experience?
The more common side effects mentioned include fatigue, which can increase as the treatment progresses, as well as mild skin irritation in the treated area and hair loss, usually limited to the treatment field. Nausea can also occur, especially when the abdomen or brain is treated, but it seems to be less frequent and less severe compared to traditional radiation, according to your sources.
And what about long-term risks? Are there any specific concerns compared to other types of radiation therapy?
In the long term, as with any form of radiation therapy, there's a potential increased risk of developing secondary cancers. However, your sources suggest that this risk might be lower with Pion therapy due to its higher precision. Some patients also report persistent fatigue after treatment or organ-specific issues depending on the area of the body that was treated.
What can patients do to manage these side effects? That's a crucial aspect for anyone considering this therapy.
Open communication with the healthcare team is key. Treatment plans can often be adjusted, and medications can be prescribed to alleviate discomfort. Certain lifestyle modifications, like a healthy diet and moderate exercise, can also help manage symptoms.
That's a good reminder. It's important to actively participate in the treatment process and attract any concerns early on. Now let's move on to the exciting part. Current research and recent developments in the field of Pion therapy, which your materials also shed light on.
Yes, research in this area is very active. Scientists around the world are working to further explore the potential of Pion therapy and optimize its application.
Your sources mention a systematic review from 2023 that compared Pion therapy to conventional photon radiation. What were the key findings of this analysis?
This comprehensive review analyzed 63 comparative studies, looking at various aspects, including treatment tolerability, patient quality of life, local tumor control, and survival rates for different cancer types. The results, cited in your sources, indicate that Pion therapy can indeed improve outcomes for patients.
That's very encouraging news. It seems that the research so far supports the potential benefits of this therapy. And what role do funding organizations like the National Institutes of Health, NIH, in the United States play in these developments?
A crucial one. The NIH provides substantial funding for research on Pion therapy, fostering collaboration between research institutions worldwide. The fact that 2 NIH-supported scientists were even awarded the Nobel Prize in 2023 underscores the importance of this research for advancing healthcare and could also benefit Pion therapy research in the future.
It shows how important long-term investments in innovative research approaches are. And what does the future hold for Pion therapy specifically? Are there any promising approaches or projects mentioned in your sources?
The future looks promising. Your sources point to a growing commitment to broadening participation in clinical trials, ensuring that the therapy is considered for all patient groups equitably. There are also innovative approaches being explored for the treatment of brain disorders, for example, through the Brain Initiative. These research efforts could yield new insights relevant to Pion therapy as well. It's safe to assume that further studies will follow, aimed at refining treatment protocols and gradually integrating Pion therapy into mainstream care.
Those are exciting developments, and we'll certainly keep an eye on them. Our deep dive is drawing to a close. Could you briefly summarize the key takeaways from the materials you shared?
Of course. We've seen that Pion therapy is a highly precise form of radiation therapy that, through its unique mechanism of action, particularly the Bragg peak effect, has the potential to reduce side effects and improve outcomes for certain types of cancer. While accessibility is currently a challenge, ongoing research and the promising results obtained so far suggest that this innovative approach could play a more prominent role in cancer treatment in the future.
It's truly impressive to see how advancements in particle physics are opening up new avenues in cancer therapy. And it's particularly valuable that therapies like Pion therapy offer the possibility of treating tumors with minimal damage to healthy tissues, which can be crucial in complex cases. We'd like to thank Jörg-Owe for his work, which has helped us better understand this important topic. And to our listeners, we invite you to consider the potential impact of such precise therapies and the importance of continued research in this field.
And one final thought-provoking question stemming from your sources. Given the rapid advancements in particle physics and cancer treatment, how might therapies like Pion therapy reshape our approach to fighting cancer in the coming decades? And what steps are needed to ensure equitable access to such innovations?
An important question indeed, one that leaves us with much to ponder. Thank you for joining us on this deep dive. Until next time.